If you're over 60, this video could change your life. Prostate problems are becoming more common among older men, and many don't even realize what daily habits are making things worse. If you've noticed frequent urination, trouble starting or stopping your stream, or even waking up at night to pee, your prostate may be enlarging silently. But here's the truth, it's not always about aging. It's about what you're doing every single day. As a doctor, I've seen men in their 60s, 70s, and even 80s live pain-free and healthy just by changing a few habits. But I've also seen others suffer because they ignored these red flags. In this video, I'll reveal 10 everyday habits that can slowly, silently enlarge your prostate. And the number one habit is the most dangerous of all. This isn't about scaring you, it's about giving you the right tools and knowledge to protect your health. By the end, you'll understand how to stop prostate growth naturally and safely. So, watch this till the end, and please share it with someone who might need this information. Let's count down the 10 habits that may be enlarging your prostate right now without you even knowing it. Habit 10. Ignoring thirst and staying dehydrated. You may not realize it, but not drinking enough water can quietly and gradually affect your prostate health. It's one of the most overlooked habits among older adults, and it's doing more harm than you might think. As we age, our body's natural thirst signals become weaker. You may not feel thirsty even when your body is already dehydrated. On top of that, many seniors intentionally reduce their fluid intake to avoid frequent bathroom trips, especially at night. While that may seem practical, this habit can actually backfire over time. When you don't drink enough water, your urine becomes more concentrated. This concentrated urine is more acidic and irritating to both the bladder and the prostate. The prostate gland, which sits just below the bladder and wraps around the urethra, is particularly sensitive to this kind of irritation. Over time, it can become inflamed and swollen, contributing to benign prostatic hyperplasia, or BPH, and enlarged prostate. Chronic dehydration also reduces your body's ability to flush out toxins efficiently. These toxins can accumulate in your bloodstream and urinary tract, adding more stress to your kidneys, bladder, and prostate. Inflammation from these toxins can cause further swelling and discomfort. In fact, studies have shown that low fluid intake is associated with higher risks of urinary tract infections, bladder irritation, and yes, even prostate enlargement. And here's something even more important. If you're taking medications like diuretics, blood pressure pills, or antihistamines, these can further dehydrate your body without you even realizing it. The combination of medications and low water intake can silently lead to a cascade of urinary problems. You may also experience side effects like dizziness, fatigue, constipation, and dry skin, all signs that your body is running low on fluids. Constipation, in particular, can worsen prostate symptoms because a full bowel presses against the prostate and bladder, creating even more pressure and discomfort. The good news? The solution is simple and free. Start by drinking small amounts of water regularly throughout the day, even if you don't feel thirsty. You don't need to chug a large glass at once, just sip steadily to stay consistently hydrated. A good indicator is the color of your urine. It should be clear or a light yellow. Dark yellow or amber-colored urine is a sign that you're not drinking enough. Also, try to reduce fluid intake only in the last 2 hours before bedtime to minimize nighttime urination, rather than cutting back all day. You can also eat more water-rich foods, like cucumbers, watermelon, oranges, or soup, to naturally increase hydration. Avoid beverages that dehydrate you, such as coffee, alcohol, and sugary sodas, especially in large amounts. These can offset your hydration efforts and add stress to your urinary system. Bottom line, staying properly hydrated helps your bladder function better, reduces irritation, keeps toxins moving out of your body, and protects your prostate from unnecessary inflammation and swelling. So don't avoid water out of fear. Use it as a natural shield to support your urinary and prostate health for years to come. A few glasses of water a day might seem small, but over time, it could make a big difference in how you feel, sleep, and function. Habit 9. Sitting for long hours without movement. You might love your recliner, your favorite chair, or your cozy corner on the couch, but too much sitting could be quietly damaging your prostate. When you sit for long hours, especially without getting up to move around, you're placing constant pressure on the pelvic region. This area includes the prostate, bladder, and surrounding muscles and nerves. Over time, this pressure reduces blood circulation in the lower body, and poor circulation is a major contributor to chronic inflammation. Why does this matter? Because inflammation is directly linked to the growth of the prostate. When blood flow is restricted, your tissues don't get enough oxygen and nutrients. Waste products and toxins also aren't flushed away as efficiently. This can lead to swelling, discomfort, and over time, an enlarged prostate. It's not just about inflammation either. Long periods of sitting weaken your pelvic floor muscles. These are the muscles that help control your bladder and support the organs in your lower abdomen. When these muscles are weak, it becomes harder to fully empty your bladder, causing residual urine to sit in the bladder. This leftover urine increases the risk of urinary tract infections and keeps pressure on the prostate, contributing to its gradual enlargement. Sitting also affects posture and spinal alignment, which can create nerve compression in the lower back and pelvis. Some of these nerves control bladder and prostate function, so when they are compromised, urinary symptoms like urgency, dribbling, or incomplete voiding can get worse. And here's a key insight: men who are sedentary for extended periods, watching TV, driving, reading, or using a computer, are statistically at a higher risk for both urinary tract issues and prostate enlargement. The risk increases even more if other factors like poor hydration, low physical activity, or being overweight are present. The fix is easier than you might think. Start by building movement into your daily routine, even if it's gentle and brief. Every 30 to 45 minutes, stand up and walk around for just 1 to 2 minutes. Stretch your legs, do a few light squats, rotate your hips, or simply take a short walk to the kitchen or bathroom. These micro-movements restore circulation and relieve pressure from your lower body. If you're watching TV, stand up during commercial breaks or place the remote farther away to encourage yourself to get up. Set a timer if needed, or use a wearable reminder device to nudge you to move. Even light physical activity like walking around the house, gardening, or doing household chores can stimulate blood flow, activate your core and pelvic muscles, and reduce prostate-related stress. Over time, this consistent movement helps maintain healthy circulation, supports your pelvic organs, and keeps your urinary system functioning better. Another powerful tool? Kegel exercises. These strengthen the pelvic floor muscles directly and can help men improve bladder control and reduce prostate discomfort. They're simple, can be done sitting or standing, and take only a few minutes a day. Remember, it's not about avoiding rest. Rest is important, especially as we age. But staying still for too long, day after day, can turn a peaceful habit into a hidden health risk. Don't let a quiet lifestyle create a noisy problem later. A little movement now, just a few steps or stretches each hour, can go a long way in keeping your prostate calm, healthy, and working smoothly. Habit 8. Drinking too much caffeine. That morning cup of coffee or afternoon tea might feel like a harmless daily pleasure, but if you're consuming too much caffeine throughout the day, it could be irritating your prostate more than you realize. Caffeine is a natural diuretic, which means it increases urine production. More urine means your bladder fills more quickly and needs to empty more often. For someone with a sensitive or enlarged prostate, this increased frequency can be a real challenge. You may feel the urge to urinate more often, even when there's not much urine in the bladder. Worse, you might struggle to fully empty your bladder, leading to frustration, urgency, or even leakage. But caffeine's effect on the urinary system doesn't stop there. It can also stimulate the muscles in and around the bladder, causing them to contract more forcefully and more frequently. This leads to a sensation of urgency, even if your bladder isn't truly full. For men with BPH, benign prostatic hyperplasia, this extra stimulation only worsens the symptoms. More trips to the bathroom, difficulty starting or stopping the stream, and interrupted sleep due to nighttime urination. Caffeine is also a known bladder irritant. It can inflame the lining of the bladder and increase sensitivity, which in turn makes the entire urinary tract, including the prostate, more reactive. Over time, this ongoing irritation can trigger low-grade inflammation in the prostate gland, contributing to swelling, discomfort, and progressive enlargement. It's also important to note that caffeine is found in more than just coffee or tea. It's in sodas, energy drinks, chocolate, some medications, and even certain supplements. Many men don't realize how much caffeine they're actually consuming in a day. If you're drinking multiple cups of coffee, tea, or caffeinated beverages throughout the day, your prostate might be under more strain than you think. So what's the solution? You don't have to give up caffeine entirely. Moderation is key. Start by limiting yourself to 1 or 2 cups of coffee or tea per day, preferably in the morning. Avoid caffeine after 2 p.m., especially if you're experiencing nighttime urination. This can help reduce bladder overactivity in the evening and improve your sleep. Also consider switching to low caffeine or caffeine-free alternatives like herbal teas, warm water with lemon, or chicory root coffee. These give you the comfort of a warm drink without the prostate-irritating effects. Pay close attention to how your body reacts. If you notice that urgency, frequency, or dribbling increases after caffeine consumption, that's your body sending a clear signal. Reducing or eliminating caffeine may bring surprisingly quick relief. Finally, remember that caffeine also contributes to dehydration, especially when consumed in large quantities. If you're already not drinking enough water, and then adding caffeine on top, the risk to your prostate health increases significantly. By cutting back on caffeine, you ease the burden on your bladder, reduce irritation to your prostate, and support smoother, healthier urinary function, day and night. Habit 7. Holding in urine for too long. You may not think twice about delaying a bathroom trip, especially if you're busy, driving, or trying to avoid public restrooms. But regularly holding in your urine for extended periods can have serious consequences for your prostate and your entire urinary system. When you resist the urge to urinate, you're putting your bladder under unnecessary stress. The bladder is a muscular organ, and like any muscle, it can be overworked. As it stretches beyond its comfortable limit, it places direct pressure on the surrounding organs, especially the prostate, which sits just below it. Over time, this added pressure can cause irritation and inflammation of the prostate. For men with an already enlarged prostate, this habit can worsen symptoms like weak urine flow, a feeling of incomplete emptying, and increased urgency. It may even lead to urinary retention, where the bladder can't fully empty at all, requiring medical intervention. Another major concern is that urine held for too long can become a breeding ground for bacteria. The longer urine stays in the bladder, the more likely it is to support bacterial growth, which can lead to urinary tract infections, UTIs. While UTIs are more common in women, older men, especially those with enlarged prostates, are at higher risk, since their bladder doesn't always empty fully. And infections can worsen prostate swelling and discomfort. In extreme cases, chronic urine retention can also stretch and weaken the bladder wall permanently, making it less effective over time. This means more frequent urination, less control, and even greater strain on the prostate. The solution is simple but powerful. Listen to your body. Don't delay bathroom breaks unnecessarily. If you feel the urge to go, try to urinate within 10 to 15 minutes. Train yourself to respond to these signals rather than suppressing them. Plan ahead if you know you'll be somewhere without easy restroom access, like long car rides or outdoor events. Use the restroom before leaving the house, and don't hesitate to stop for a break if needed. Also, try to urinate fully each time. Rushing through the process or getting up too soon can leave residual urine behind, which contributes to irritation and weakens bladder function over time. Take a moment to relax, breathe, and make sure your bladder is truly empty. If you struggle to urinate when you first sit down, try running warm water or using relaxation techniques like deep breathing. Stress and anxiety can tighten the pelvic muscles and make urination more difficult, especially if the prostate is already enlarged. By allowing your body to follow its natural rhythm, you reduce stress on the bladder and prostate, lower the risk of infection, and support a healthier urinary flow. It's a small change, but one that can make a big difference over time. Habit 6. Eating a high-fat, low-fiber diet. What you eat every day doesn't just affect your weight or energy, it plays a major role in the health of your prostate. A diet that's high in saturated fats and low in fiber may silently contribute to prostate enlargement, inflammation, and worsening urinary symptoms. Many older men fall into the habit of eating convenience foods that are rich in red meat, processed snacks, fried items, and dairy-heavy meals. While tasty and filling, these foods often contain high levels of saturated fat, which can trigger chronic inflammation throughout the body, including in the prostate. Studies show that diets rich in saturated fats are associated with a higher risk of developing benign prostatic hyperplasia, BPH. Saturated fats may increase the production of certain hormones, like dihydrotestin, DHT, which stimulate prostate growth. And when combined with low intake of protective nutrients like antioxidants, the prostate is left vulnerable to inflammation and oxidative damage. Another major issue with a low-fiber diet is poor digestion and constipation. When you don't get enough fiber from fruits, vegetables, legumes, and whole grains, bowel movements slow down. Constipation not only makes you feel bloated and uncomfortable, it can actually place pressure on the prostate and bladder, worsening urinary symptoms. A full rectum presses against the bladder and prostate, making it harder to empty your bladder fully or start a strong urine stream. Fiber also plays a key role in detoxification. It helps remove excess hormones and waste from the body through the digestive tract. Without enough fiber, toxins linger longer in the system, increasing inflammation and hormonal imbalances that contribute to prostate issues. So how can you turn this around? Start by reducing your intake of saturated fats, especially from processed meats, like bacon, sausages, and deli meats, deep-fried foods, and full-fat dairy. Instead, include more healthy fats like those found in fatty fish, salmon, sardines, mackerel, olive oil, avocados, and nuts. These foods contain omega-3 fatty acids, which help fight inflammation and may actually support prostate health. At the same time, increase your fiber intake with a variety of fruits, vegetables, legumes, seeds, and whole grains. Leafy greens like spinach and kale, berries, apples, lentils, oats, and flax seeds are excellent sources of both fiber and essential nutrients that support hormone balance and reduce inflammation. Not only will you support a healthier prostate, you'll also improve your digestion, support heart health, and likely feel more energetic overall. As an added tip, drink plenty of water along with increased fiber to avoid constipation. Gradually boost your fiber intake so your digestive system can adjust comfortably. The foods you eat every day act like either medicine or poison for your body. Choosing anti-inflammatory, high-fiber, nutrient-rich meals is one of the most effective long-term strategies to keep your prostate healthy and functioning at its best. Habit 5. Not getting enough exercise. You've probably heard that regular exercise is important for heart health, blood sugar, or weight control. But did you know that a sedentary lifestyle is also linked directly to prostate enlargement? Lack of physical activity is one of the silent contributors to inflammation throughout the body, including the prostate gland. When you don't move enough, your blood circulation slows down, your muscles weaken, and your body's ability to detoxify and regulate hormones is compromised. Over time, this creates an environment where inflammation thrives, and inflammation is one of the key drivers of benign prostatic hyperplasia, BPH. Men who don't get regular exercise are also more likely to be overweight or obese, and this adds another layer of risk. Excess abdominal fat, especially around the waist, can increase estrogen levels and insulin resistance, both of which have been linked to enlarged prostate and urinary symptoms. In fact, belly fat isn't just sitting there, it produces inflammatory chemicals that may further irritate the prostate. On the flip side, studies have shown that men who engage in moderate to vigorous physical activity several times a week have a lower risk of BPH and fewer urinary symptoms. That's because exercise helps regulate hormones, reduce inflammation, improve blood flow, and strengthen the muscles of the pelvic floor and lower abdomen. So what kind of exercise is best? The good news is, you don't have to run marathons or lift heavy weights. Simple, consistent movement can make a major difference. Brisk walking, light jogging, swimming, or biking for 20 to 30 minutes most days of the week is a great place to start. These aerobic exercises help increase circulation, support metabolism, and reduce systemic inflammation. Adding gentle strength training 2 to 3 times per week can help build lean muscle, improve balance, and support metabolism, all of which benefit overall hormone health and prostate function. One often overlooked benefit of exercise is its impact on stress. Physical activity helps lower cortisol, the stress hormone, which is known to influence hormone levels and inflammation in the body. Less stress means less tension in the pelvic muscles, fewer spasms in the bladder, and better urinary control. And don't forget your pelvic floor. Kegel exercises, usually associated with women, are also incredibly effective for men. They target the muscles that support the bladder and prostate and can help improve urinary flow and control. Just a few minutes a day can lead to noticeable improvements. If you've been inactive for a while, start slow. Even short walks, chair exercises, or light stretching sessions can begin to wake up your circulation and support your prostate. The key is consistency. Your body was made to move, and when you honor that design, your prostate benefits, too. Just 30 minutes a day can go a long way in reducing your risk of enlargement, improving urinary health, and boosting your quality of life. Habit 4. Ignoring sleep problems. Sleep might seem like a luxury, but for your prostate and your overall health, it's a necessity. Unfortunately, many seniors suffer from poor sleep, frequent nighttime awakenings, or even insomnia, and they often ignore it or chalk it up to just getting older. But this habit of neglecting quality sleep can quietly contribute to prostate enlargement and worsening urinary symptoms. Here's why sleep matters so much. During deep sleep, your body enters a healing state. It balances hormones, reduces inflammation, supports immune function, and allows your organs, including the prostate, to rest and repair. When your sleep is disrupted or too short, that healing process gets cut off. One of the most important hormones affected by poor sleep is testosterone. This hormone plays a major role in regulating prostate size. Lack of sleep lowers testosterone levels and can increase the production of stress hormones like cortisol, which promotes inflammation and may aggravate prostate swelling. The result? More frequent urination, more urgency, and greater difficulty with starting or stopping the flow. Another problem is the vicious cycle many men fall into. Prostate enlargement often leads to nocturia, waking up multiple times at night to urinate. But poor sleep then makes inflammation worse, which further enlarges the prostate, leading to even more nighttime trips. It becomes a downward spiral that's hard to break unless you address both the sleep and the prostate together. Sleep deprivation also affects your bladder control. When you're tired, your pelvic muscles may be weaker and less coordinated, leading to more dribbling or urgency. And if you're constantly waking up in a light sleep state, your body never reaches the deep, restorative sleep that promotes full body repair. So what can you do to improve sleep and protect your prostate? Start by building a consistent sleep routine. Go to bed and wake up at the same time every day, even on weekends. This trains your body's internal clock and helps regulate hormone levels. Avoid caffeine and large meals in the evening. As mentioned earlier, caffeine is a diuretic and bladder irritant that can cause nighttime urination. Try to avoid drinking too many fluids after dinner, but make sure you stay well hydrated during the day. Create a calm, dark, and quiet sleep environment. Keep the bedroom cool and remove electronic devices that emit light or noise. If you suffer from frequent nighttime urination, consider doing gentle Kegel exercises before bed and fully emptying your bladder twice. Once when you begin your bedtime routine, and again just before sleeping. Also, don't ignore sleep disorders like sleep apnea, which is common in older men and causes disrupted breathing throughout the night. Untreated sleep apnea not only leads to poor sleep quality, but it also raises inflammation and puts stress on the entire body, including the prostate. If you suspect your sleep issues are persistent or affecting your quality of life, don't just live with them, talk to your doctor. Better sleep isn't a luxury. It's a key part of natural healing and prostate health. By prioritizing restful, uninterrupted sleep, you're giving your body, and your prostate, a chance to reset, recover, and function more smoothly day after day. Habit 3. Overconsuming alcohol. Enjoying an occasional drink is part of many social routines, but drinking alcohol excessively or regularly can quietly harm your prostate health and worsen urinary symptoms. Alcohol acts as a diuretic, increasing urine production and causing you to urinate more frequently. This can put extra strain on the bladder and prostate, especially if your prostate is already enlarged or sensitive. Frequent trips to the bathroom disrupt your daily routine and your sleep, leading to fatigue and frustration. But the effects of alcohol don't stop there. Alcohol irritates the lining of the bladder and urinary tract, which can lead to inflammation and increased sensitivity. For men with prostate issues, this means more urgency and discomfort. Chronic alcohol consumption may also impact your hormone balance. It can reduce testosterone levels and increase estrogen levels, which can contribute to prostate growth. Additionally, alcohol stresses the liver, which is responsible for metabolizing hormones and clearing toxins. When the liver is overburdened, hormone imbalances and toxin buildup can worsen prostate inflammation and enlargement. Another concern is that alcohol can impair your immune system, making it harder for your body to fight off infections, including urinary tract infections, that can aggravate prostate symptoms. If you're a regular drinker, consider your intake carefully. Moderation is key. The American Heart Association suggests no more than 1 drink per day for men, and even less for those with prostate issues. You might also notice that certain types of alcohol, like beer or wine, affect you differently. Pay attention to how your body reacts and adjust accordingly. To protect your prostate, drink alcohol sparingly and always balance it with plenty of water to avoid dehydration. Reducing alcohol intake can lead to noticeable improvements in urinary comfort, reduce nighttime trips to the bathroom, and help keep inflammation in check. Habit 2. Smoking or using tobacco products. If you're still smoking or using any form of tobacco, it's time to know how this habit affects your prostate and your overall health. Tobacco contains thousands of harmful chemicals that damage blood vessels, reduce oxygen flow, and increase inflammation throughout the body. The prostate is no exception. Smoking has been linked to higher risks of prostate enlargement, prostate inflammation, and even prostate cancer. One of the main ways smoking harms the prostate is through reduced blood flow. Healthy circulation is essential for delivering oxygen and nutrients to the prostate gland and removing waste products. When blood vessels constrict or become damaged due to smoking, the prostate tissue can become stressed and inflamed. This chronic inflammation can cause the prostate to enlarge and worsen urinary symptoms. Smoking also weakens your immune system, making it harder for your body to fight off infections, including urinary tract infections or prostatitis, which can further inflame the prostate. In addition, smoking contributes to hormonal imbalances. It can affect testosterone levels and increase oxidative stress, both of which promote prostate tissue growth and damage. Quitting smoking can be challenging, but the benefits are profound. Not only will your prostate health improve, but your heart, lungs, and overall vitality will benefit tremendously. If you're struggling to quit, seek support from your healthcare provider. Remember, it's never too late to stop smoking and start healing. Habit 1. Ignoring early symptoms and avoiding regular checkups. One of the most dangerous habits men have when it comes to prostate health is simply ignoring early warning signs and skipping regular medical checkups. Prostate enlargement often develops slowly and quietly. Early symptoms like frequent urination, a weak or interrupted urine stream, urgency, or waking up at night to pee might seem mild or easy to dismiss. Many men assume these changes are just a normal part of aging, and they often don't mention them to their doctor. But ignoring these early signs can lead to serious complications over time. If left untreated, an enlarged prostate can cause bladder damage, urinary retention, infections, and even kidney problems. Regular checkups with your healthcare provider are essential for catching prostate issues early. During these visits, your doctor can perform simple tests, like a digital rectal exam, DIE, or prostate-specific antigen, PSA, blood test, to assess your prostate health before symptoms worsen. Early diagnosis allows for more treatment options, many of which are natural or minimally invasive. You can make lifestyle changes, start medications, or consider therapies that prevent progression and improve your quality of life. Don't wait until symptoms disrupt your daily routine or cause discomfort. Take control by monitoring your urinary health, tracking any changes, and discussing them openly with your doctor. Prostate health is a team effort between you and your healthcare provider. Staying proactive, informed, and attentive to your body's signals gives you the best chance to live pain-free and maintain your independence for years to come. Now that you know the top 10 habits that silently enlarge your prostate, the question is, what will you do next? These aren't just small changes. They are powerful steps that can prevent months, even years, of discomfort, sleepless nights, and unnecessary medication. If you're over 60, the time to act is now. Don't wait for symptoms to get worse. Start by changing just one habit this week. Drink more water. Walk a little more. Say no to that extra slice of bacon. Every action counts. And don't forget to try the Senior Health Tracker app linked below. It's one of the simplest tools to stay consistent and in control. Your prostate won't heal overnight, but with the right habits and a little consistency, your body can work wonders. Thank you for watching, and please, if this video helped you, share it with your friends, brothers, or anyone over 60 who needs this. You're not alone in this journey. And with the right information, you're never too old to start healing. Take care of your prostate, and it will take care of you.